Each year, an estimated 6 million children die before celebrating their 5th birthday. 45% of these deaths are from causes related to malnutrition. According to the most recent National Nutrition Survey in 2014, stunting, underweight, and wasting affect 24.9%, 14.5%, and 6.8% of children under 5 years old, respectively. These rates are much higher among the North Mountains region and Tangwen. Food insecurity and inadequate nutrition and hygiene practices of pregnant women and children are the main causes of poor nutrition. Helen Keller International is dedicated to combating the causes and consequences of blindness and malnutrition. Helen Keller International was founded in 1915 and was inspired by the deaf-blind author Helen Keller. Helen Keller International is an international nonprofit organization working in 22 countries all over the world. The Improving Household Food Security and Nutrition through Enhancing Homestead Food Production program was initiated in 1988 in Bangladesh. The EHFP model has been successfully implemented in Cambodia, Nepal, the Philippines, Indonesia, and some countries in Africa, as well as Vietnam. To build on the successes of Helen Keller International around the world, HKI officially opened an office in Vietnam in 2004. Today, HKI Vietnam focuses on 2 main program areas: child sight and nutrition for pregnant women and children. With enthusiastic and dedicated staff, programs organized by HKI Vietnam have reached thousands of people. Child sight programs in Nam Dinh, Kon Tum, and Can Tho screened over 70,000 primary and secondary school students. The programs brought the light of hope to 5,400 children with refractive errors. An enhanced homestead food production program was successfully implemented in Son La province and was scaled up to Hoa Binh and Lai Châu provinces. The beneficiaries of the program are children under 2 and women of reproductive age. The EHFP program has 4 main components: agriculture, nutrition, gender equality and advocacy, and market and business startup. In order to increase the role of local authorities in managing, monitoring, and accelerating the implementation of the EHFP program, HKI established District and Commune Project Management Unit. EHFP beneficiary households are poor households which have at least 1 child under 2, sufficient land for home gardening, and are committed to the project. Beneficiary households having at least 200 meters square of land and high enthusiasm and commitment to the project were chosen to become village model farms. VMFs supply beneficiary households with high-quality seeds, seedlings, and agriculture knowledge. The EHFP program established village facilitator teams, including village health workers, women, and agriculture extension officers, who conducted nutrition behavior change communication activities and cooking demonstrations for households and caregivers. The EHFP project offered capacity development training courses for agricultural facilitators and nutrition facilitators. These courses focused on agriculture technique, composting, ENAs and EHAs, and also on communication skills and household finance management. The EHFP project provided agriculture inputs for the cropping season to VMFs and beneficiary households. To enhance households' knowledge on cultivation, the project held monthly group discussions in each village, combined with cooking demonstrations using available food sources, and home counseling of facilitators and technical specialists. The project supported VMFs with incubators to hatch eggs for beneficiary households and biogas to improve home hygiene and use for cooking purposes. A volunteer festival of students gathered hundreds of young volunteers from all over the country. They helped target households and local schools with gardening and organized a cultural exchanges festival. The Nutrition Festival Day is the highlight of the EHFP program, as it includes several popular activities: food demonstrations, an agriculture and nutrition knowledge competition, prenatal testing, anthropometric measurements of children, and a nutrition counseling corner. For the last 3 years, HKI has collaborated with local and national government agencies, including the National Institute of Nutrition, Committee for Ethnic and Minority Affairs, Sonla Department of Agriculture and Rural Development, and Sonla Department of Health. After a 3-year intervention in Sonla, the EHFP model had significant achievements. 565 households in Tanglang and Munglang, Fujian District, Sonla Province, received seedling and technique support related to raising animals and planting. 1,674 people attended community communication sessions about nutrition, agriculture, and household economics development. 90% of children received 4 food groups in their daily diet. Ethnic group food security increased by 1 HFIAS point, or Household Food Security Access Scale, after 1 year of intervention. Women's involvement in household decision-making processes increased by 9% on food selection, 7% on healthcare, and 16% on major household decisions after 1 year of intervention. HKI brought happiness, laughter, and a fresh start for children in remote areas. The EHFP program will next join hands with poor mountainous people in Laiqiu and Huabing. Let's join hands for the comprehensive development of children.